has to record it as well. Is that all right?
That's fine for me. Thank you. Okay, so we're talking about the staff portability framework. This is something that we've developed in Leeds, and it's operated by the Leeds Health and Care Academy on behalf of the Leeds system. It is something that we're getting lots of queries about from outside of Leeds, and there are examples of similar things springing up now in other geographical patches. But just to be really clear, the geography that we're talking about today is the Leeds Health and Care system just now. Can we move on to the next one for me? Okay, so sharing staff across organisational boundaries is something that has been of interest in the health and care system for quite a while. And indeed, one of the first places where we successfully shared staff across organisational boundaries was during the COVID vaccination service setup, where we needed people from all across the health and care system, from all different employers, to come together into a single vaccination service at pace to vaccinate hundreds of thousands of people across Leeds. The portability agreement allows people to flow across those organisational boundaries in a legally safe and indemnified way, subject to signatory organisations having the correct legal sign-off in place and the correct insurances in place. So it means that a professional from one organisation can safely work in another organisation on a specified piece of work or in a specified area, knowing that their work is protected in the same way that it would be if they were working in a service of their own host employer. 29 organisations in Leeds so far have signed up to the agreement. There's a list of some of them there, which include 23 GP surgeries. A really important point here is that GP surgeries, because they are individual employers, need to sign up to this agreement separately. So the agreement is signed on an employer by employer basis. It wouldn't, for example, a PCN wouldn't normally be a signatory unless it was the direct employer of the people who worked within that PCN. Can I have the next slide, please, Emma? Okay, some important points about the staff portability framework. It's for short-term sharing of staff in general. It's usually used for either short sporadic periods or a relatively short joined up period of time. Where people are looking for longer term staffing arrangements, sometimes there are other means of using staff that work better than the staff portability framework, and we'll talk about a couple of those shortly. The document itself, as I've alluded to on the last slide, addresses the legalities and liabilities around sharing staff across organisational boundaries. So it removes the requirement to have individual memoranda of understanding either for a service or for individual members of staff, or honorary contracts, things like that. The sharing is based on staff volunteering to go across organisational boundaries, not on being compelled to go across organisational boundaries. So there's a very mutual agreement principle that flows through this framework. The specific scenario of each individual sharing arrangement gets covered by a separate schedule. So there's a foundation agreement, and then each arrangement has its own schedule that gets appended to the agreement between the signatory organisations that are involved in that particular piece of sharing. The Leeds One Workforce team within the Leeds Health and Care Academy, as I've said, administer this framework, and they're the holders of the agreements and schedules. By signing up to the agreement, potentially signatories have access to sharing opportunities across a wide range of partners. So if there is a challenge where they require staff sharing, they know that there's already several dozen partners in the system who might be amenable to responding to that sharing request or to working with them. Next slide, please, Emma. I think, Emma, can we send these slides out afterwards? There's a couple of slides that have very small flow charts on. This flow chart, I'll just describe the purpose of it, and you can see the detail of it when we send it out afterwards, and you can see it at your leisure. This takes you through a really simple flow chart for when the staff portability framework is and probably isn't appropriate. So, for example, if it is a really long-term change where you need a specific person, you might be better off looking at a secondment or a piece of recruitment, and it takes you through a set of yes/no decisions of that nature until you come to a determination of whether or not the staff portability framework is going to be right for your organisation in the particular circumstance that you're thinking about using it. The Health and Care Academy, of course, are on the other end of a phone or an email if you need help working through any of the steps. Can I have the next slide, please? Lovely, thank you, Emma. I've got a couple of slides that just talk about some examples of where the agreement has been used in Leeds. On a primary care basis, we've had the spirometry pilot, which involved 3 employees from practices within 3 different PCNs, as well as LTHT employees working on a spirometry service. And just the agreement made it relatively seamless in terms of being able to do that work together rather than bashing too much into obstacles created by different organisational processes and systems. Next one, please, Emma. Another fairly high-profile example in the city, which the portability framework has underpinned, is the Transfers of Care Hub, where we have a number of different big statutory employers in Leeds working together within the hub to try and facilitate patient flow out of hospital. So addressing a really key priority for the system. And the agreement meant that that Transfer of Care Hub could be set up really very quickly, with people able to access the systems that they need to, regardless of which employer in the partnership they are employed by. They can all deal with the same set of patients together and in a consistent way. Next slide, please, Emma. It's just nice to have a photograph and a quote alongside any case study. So we've just got an example here of some feedback from the project manager involved in the Transfer of Care Hub, talking about some of the ways in which the portability agreement made the working together across organisational boundaries smooth. This was particularly, her example is particularly around access to systems. I've got 3 more slides, I think. How do people sign up to the staff portability framework? If your organisation isn't already signed up to the staff portability framework and you decide that it's something that you want to do in anticipation of perhaps needing it in the future, simply contact the Leeds One Workforce team at their email address, which is on this slide. They'll send you the details of the framework itself, so you can have a really good look at it, understand its scale, context, what it covers. Really importantly, organisations who are considering signing up to the agreement need to make sure that they're happy with the legals and insurances that are part of the agreement. So essentially, organisations need to be clear that they've got the systems in place that protect them and anybody from another organisation who comes and works with them with the correct insurances and indemnities. It's the what if something goes wrong question. And we just try and use the agreement associated with legal advice taken usually by a signatory before they sign up to make sure that those insurance and indemnities are in place from the outset, so that in the unlikely event that something goes wrong further down the line, all parties have the protection that they need. Once the agreement is signed, it gets returned to the Leeds One Workforce team, who hold all of the details, and then you're ready to go. Next slide is another flow chart which says, how do I use the framework once I've signed up? I think the QR code on this slide, which again, we'll send out the slide deck afterwards so you can actually read the detailed flow chart that's on here. But the QR code would take you to the form that essentially says, I have a need to either share my staff or receive some staff from somewhere else to work on this particular piece of work or to carry out this particular service. So that's the formal form that you would fill out with Leeds One Workforce. What we're finding increasingly at the moment is that we often have groups of organisations come and inquire about the portability agreement at the same time. So perhaps 2 or 3 organisations have already decided that they want to share staff across their organisational boundaries to work on a particular piece of work. The form is also relevant there, but then the workforce team can simply work with you to make sure that all the right signatures and agreements are in place so that that sharing of staff can happen for that piece of work. Next slide, please, Emma. We've got some FAQs on this slide. Again, we'll send them out rather than me going through them individually. I've already covered off the point about individual practices or individual care homes indeed needed to sign up to the agreement on a case-by-case basis as individual employers. So it is the employing organisation that is the signatory rather than a PCN, for example. And the important to say, where people sign up to the agreement doesn't mean that there's any obligation to send your staff across organisational boundaries to work for anybody else. It simply means that there is that option. You've opened yourself up to that option of sharing your staff if you would like to, or having other people share staff with you. So it just means that you have set the stage to be able to take advantage of the agreement. It doesn't mean that you have to ever use it or send staff anywhere else. Can I go to the final slide, Emma, and then we'll just see if there's any questions. If after this session, we'll obviously take any questions straight after this slide, but if after this session you want to find out more on a more detailed or individual basis, you can of course get in touch with the Leeds One Workforce team via the email address on this slide, and they'll aim to have a more detailed conversation with you one-to-one so that you can chat in detail about the specifics of your circumstances. We can, of course, also take questions now about any aspect of the agreement. So, Emma, if you're all right to stop sharing. Thank you very much. And I wonder, given that people might have questions related to their own organisation, do we want to stop recording now as well, Emma?
Yeah.
Thank you very much.
Find it.